All right, I'd like to welcome everybody to today is Wednesday, August 21st, the Benton-Franklin Health District Board meeting. We're gonna make a change. Do you want to do roll call first? Okay, done. Okay. We're gonna make a change real quick. We have an executive session that we're gonna jump into for 30 minutes. It's for discussion of legal counsel for RCW 4230-1101 for 30 minutes. The time is 1:31. Oh yeah, to include the full board, Janae, Aaron, and Aaliyah, sorry, Amanda and Chris. All right, we're on our executive session. The time is now 2:05. Given no decisions were made. We'll move on to, can we get approval of July 17th, 2024 regular board meeting minutes?
I move to approve the minutes for the previous meetings, July 17th, 2024.
I'll second.
Got a motion in a second. Any discussion? Hearing none, all in favor say aye.
Aye.
Any opposed? All right, good. Moving on to public comments. Is there anybody here? See anybody? Is there anybody online? If you're online, can you raise your hand?
If you'd like to make a public comment, you can press *9 if you're on the phone, or you can raise your hand inside the Zoom app.
You did that very well.
Don't see anybody? Okay, all right, we'll close public comment. We'll move on to senior staff comments. Any? Well,
Nothing today.
moving right along, unfinished business. Health Officer Recruitment Committee.
You're talking about Rilla's HR manager.
So Brandy's gonna go first, give you guys an update, and then I'm gonna finish us up, and then we'll answer any questions.
Also, that's why I had the slash.
Yeah.
Janae after.
Yeah, this is just Brandy.
Thank you. Just wanted to give you an update on our health officer recruiting efforts. It has been posted for several months now. I've gotten a total of 77 applicants. The majority of them are not qualified. I see a trend with a lot of these positions is that people just apply when they see a wage maybe, or they think they're qualified. They don't actually read the minimum qualifications. So out of those 77, there's a possibility of 14 of them being qualified. And out of those 14, there are only 2 that are local area, and meaning the Pacific Northwest. And so they may or may not be qualified. They do have elements in their resume that would make them possibly qualified, but we have not reached out to them yet to know if they are in fact qualified for that position. So at this point, we're continuing to collect applicants, and I'm keeping them reviewed and trying to keep my numbers up to date current with that.
So my portion of this is I wanted to talk to you about how things have been going with Dr. Kreger. He's actually not here today. He's on vacation, which makes this great timing to be able to talk about him. He's not here. We've got Heather here representing the office, but yeah, he's on vacation. We let him go on vacation. So I'm going to make my quick elevator pitch here for you all. So as you know, having the right fit for this position is important to us. And as we consider how we move forward, I wanted to share with you how things are going with Dr. Kreger, which is very well. He's integrated with our team quickly and easily, and he has regular check-ins with our leaders, actively participating in activities under the scope of the health officer role. He genuinely cares about our staff, community partners, and is passionate about his work in local public health. While it did not used to be that health officers were regional or even hybrid, we appear to have come into a situation where Dr. Kreger's integrity, disposition, follow through, and support are all in alignment in this hybrid format. My point in sharing this perspective with you all is as we are in our era of innovation and out of the box thinking, this could be a situation that we continue to explore and consider as we continue down the path of recruitment. While Dr. Kreger is out on a much needed vacation, he has relayed to me similar sentiments in how much he enjoys working with BFHD, our staff, and the board, and is open to continuing a hybrid model. We don't have to make any decisions today, but it's something that I've been having conversations with our leadership, our staff, trying to get a feel of how's it going with the integration. And I'm getting a lot of positive feedback. And it's not necessarily something that's been traditional with the health officer working a hybrid situation, not necessarily what we started in going, but we found something here. And I want to keep that door open, even as we go through recruitment, knowing he's also reciprocating in the same manner. One other thought that I want to share with you all is the way that Dr. Krager has teed himself up is he's now the intern for Walla Walla, ourselves, Mason, and Cowlitz. And yeah, he has a full schedule, but one of the things he's looking at is that regional concept. And so what would that mean for BFHD to be partaking and sharing the cost of a health officer, but also participating in a regional health officer concept that he's excited about. So I just want to put that out there as part of the update.
I assume cost savings as a shared,
Totally.
you know, I think that's one of the benefits, given you get somebody of high quality, but you're not paying the.
What about like with him, you know, doing virtual and stuff? I'm just thinking, you know, he'd be getting more money if he was in person, you know, like, you know, I'm saying type thing, like if he was working full time, where it's part time, in person, or I mean, virtual or whatever. But again, I agree with the regional type thing too, where.
Yeah. One of the things that he and I have been talking about as of late, if this kind of keeps going forward, is him coming down once a month to have an in-person. So he's actually going to be here at the board meeting for September. And we're going to keep working through those conversations of how we can get him more in person and see if it's feasible. His family arrangement that he's got, just it's impossible. There's just, and he's told us if he could, he would absolutely relocate here, that he loves it so much working with BFHD.
So currently, how much are we compensating him on an annual basis?
I believe it's 200 an hour, right around 200 an hour.
Just under that, but yeah.
And how many hours is he charging us?
Up to 20.
So, okay, 20. And then okay. I'm gonna look at it a little different. There's a potential cost savings on that. I get that part. I'm okay with that. And I liked it, but if he's gonna be potentially a full-time hybrid position or a health doctor here for us, I like to interview him still. I want to see his resume.
Yeah.
And then at the same time, our Benton County is unique compared to other counties as well. And I want to make sure he's going to be a fit for Benton County, not just because Walla Walla could be different than Benton County. And I want to make sure that we represent Benton. When I'm talking Benton County, I know we have Franklin County Commissioners, and they're probably going to be the same way. Is it a good fit for us along the term if it's hybrid? Absolutely. If they're going to look at that avenue, I say we cross our T's and dot our I's, because I don't want it to go right. That's a fair thing to do for anybody. That's just treating everybody equally.
I agree with what you're saying too, because I'm wondering, I just had a thought, what if it is we try to relocate him here to Benton or Franklin County? He's working together for us, but also Walla Walla, Yakima. Like if we can somehow team up with the region where, okay, yeah, he gets a car allowance to transfer to Yakima or Walla Walla or something.
He can't relocate.
Yeah, you can't
So
really.
you can't look at all.
So,
Okay.
so that's why I just want to make sure, you know, is it a good fit? Does it represent the two counties? And treat them as if we would any other person applying for the position, so we can say we've done our due diligence and we cross our T's and dot our I's. And if we can do that, I would be good with something like that, but I want to make sure we're doing it and we're treating everybody equally on that. Because there might be someone that's just as great or even better out there, and so interviewing them too. I want to make sure we have a good fit. And if we get someone here, that's more, I think that's more viable for the community if we have someone here locally.
Yeah.
That would be an alternative though. Okay. That's just my thoughts.
I do think staff input is a very valuable thing, though, keeping us posted on how staff's integrating and how,
Oh, I agree.
you know, because we had somebody here local.
Yeah, no, I agree.
And so, you know, I
Yeah.
think, you know, listening to some of that and making sure that we find a good fit
Yeah.
with
No, I totally agree with that.
personalities too, and the work and the qualifications.
I've always learned that it's always good to listen to the community, listen to your staff. As long as you have good staff, we have good staff here. And then also listening to your colleagues and then doing your own homework, and then by all that combined together, you can make a better educated decision. That's worked pretty well. So I totally agree with you.
All right. Okay, we'll move on to new business. Office of the Health Officer updates. Madam.
Well, I, as the deputy to the health officer, attest to the fact I really like working. He's made it really easy to communicate with. He and I have talked about how to get him more virtually connected to some of the community things. Example, try to figure out how to connect him with the meeting I had with the medical groups down in Prosser. I met last week with them, and 7 in the morning and I just couldn't quite figure out how to Teams him in, but, in the school nurse meeting today, if he wasn't on vacation, he was actually going to videotape a message to them. Or come virtually in that mode. So I know he's real willing to connect as much as possible.
So being in that position that you're in, you know, do you feel it would be, I'm just curious, do you feel it would be easier to be able to, is he pretty easy to get a hold of? I mean, no matter what, all of us are gonna be in meetings and we're working, you know, and da. But do you think that the relationship you have with them is very easy to get a hold of them or to respond back?
Yeah.
And that's important to me because that's a good decision. If he can, he or she can, that's a good thing. And that makes the job here easier when you guys need that to do. And that would be, you know, if we're looking at doing something in a hybrid mode.
Right. I've had absolutely no problem getting a hold of him when I need to, getting him connected with staff when I need to. If questions have come up that we really need the health officer blessing for the answers, we've not run into a problem.
Oh, that's good. That's good. Thank you.
And then, you know, he makes sure he's got the coverage like this week. Scott Lindquist is back on board. Well, he's on vacation. And Stephen's been a health officer for so long and in so many capacities that has made the transition a lot easier, especially in the world of TB. I know he gave a talk about TB and currently working on some interesting cases. And I mean, he's just knowledge-wise right there with the information we need. So.
Very good to know. Thank you.
Yeah. So kind of what I put together for the report is coming up in October, the Emergency Preparedness Department and several of us are putting together at the request of local providers, specifically the hospitals, a special pathogens workshop. Kind of comes out of a long time ago when we were dealing with the potential of Ebola. And Ebola is still circulating in certain areas in Africa. And the hospitals really haven't worked through their emergency plans and what would they do if. And so the Emergency Prep Department has put together what looks to be a really good workshop, inviting EMS, hospitals, health department, and others to figure out just what we would do and where we need more education on that topic. Pertussis is definitely up in the community. We're working a couple of clusters right now. Walla Walla pointed out that they have some, and nationally it's at an increase. So we'll be pushing some media out to make sure that people are vaccinated and using precautions because it, you know, definitely can be deadly, especially to an infant if they are to catch. COVID also, as you've heard in the news, is up, and it's up all around the nation and us too. The last thing I wanted to mention, I know months ago, when Dr. Giske was here, he announced that I had been appointed to the governor's public health advisory board. And we were tasked with looking at COVID after action reports. And we have now published our draft after action report. And I have gone out to various entities such as Prosser. I have a meeting with the Hispanic Chamber of Commerce coming up just to go over what we came up with as our areas of recommendation. And what I'd love to do is maybe send out the report through the email so that all of you could read it. But the 3 areas we focused on were identify and sustainably fund streamline data and communication systems, because we saw how badly communication was hampered. It's disjointed. Focus needs to be paid to that. Prioritize community integrated health and emergency response planning that supports improved system capacity, funding flow, and decision-making. Not waiting until the emergency is in front of us, but we need to have systems in place, funding in place for the next time, because it'll happen again. And then really looking at our healthcare system capacity and what we need to do to support that, to build that critical infrastructure to take on situations like this. And one of the big areas had to do with funding and making sure that the people who need the funding have access to the funding. It was, again, sometimes difficult to access, it wasn't timely, it didn't get to the right people, or necessarily the money was earmarked for certain things that maybe we really didn't need it for that purpose, but we could have used it for a different purpose. And the last, adequately fund capacity to build and sustain relationships and partnerships. And that one really speaks to me because during COVID, we were reaching out to all kinds of community partners, and we expected them to come to the table uncompensated to help plan and make decisions. And so that was one of the big areas of focus, is we need to be able to compensate financially if your company is sending somebody to the table to help with the response. If your hospital is, there should be funding available to support that. So with that, any questions?
Got it. Thank you.
Thank you. Oh, and the next thing we'll be doing is writing up some policy.
Well, that's what-
Yes.
So I do want to say, Heather, I really appreciated the weekly meetings that Jason would have with all the community
Yeah.
leaders. And I felt that that was so valuable because you're hearing from the site, you're hearing from the health department, you're hearing from the fire departments. And I thought that just even being able to listen in on that and to understand what everybody was doing was a tremendous effort. And really encourage that model in the future for other future emergencies. And we were just a small little partner, but it just really helped us really understand what was going on in our own community, that we could pass that information.
It's good to hear. And it would be nice to compensate people for the time they spend doing all of this, so.
I think we were just appreciated that you had a seat at the table, just to listen. So thank you.
All right, thank you.
All right. Environmental health assessment update.
I'm gonna introduce myself because I haven't seen you guys in person. My name's Sierra Knudsen. I'm the Investigation Planning Preparedness Manager. So the discussion that Heather was talking about with the bullet tabletop is actually with my program, and Brian Fackler is leading that. I do want to take a moment, since I've got you in person, to say I really appreciate the work you're doing. You guys are really engaged. You really lean into the discussion. You have good questions. I know the feedback that I've gotten from my staff is that they're really appreciative of that. It feels like you guys are hearing us, you're engaged, you're advocating for us. I've been part of boards that just kind of checked out, they're on their phone, they're signing off on stuff, but they're not really engaged. So I really appreciate your time and effort. It makes a huge difference. Next slide for me, Lauren. So part of our environmental health assessment is that we received some FPHS funding that has really allowed us to expand our preparedness, our polyanalysis, and then also our climate impacts. Erin has got a phenomenal brain. She really thinks at stuff in big system picture. And one of the things that came through is that we do the CHIP through Carla's program, but we really don't do it from an environmental health impact. So one of the goals that when we received that funding was that she really wanted to do an environmental assessment. And that would be the first of a kind for us. It would be, I think, the third one done in Washington State. So it would be new, but gives us a lot of opportunity to do something, which would be pretty exciting and give us information from the community as well. It does parallel with the CHIP. Our intent in the next 3 years is to link them up together, to have continuity, to have messaging continuity, and also to have build that brand in that our community can trust as well. We're integrating the MAP 2.0 framework, which is part of what CHIP uses. It's a pretty phenomenal framework that comes out of CDC. It's got a phenomenal work plan. It's pretty detailed instruction, which is great. It means we're not doing everything from fresh scratch. It's built a lot of it in for us. And then we're integrating in the PACE framework, which is a lot of the science and data as well. It's going to be a 2-year project. We're about 8 months into it right now. We're currently in phase 1 and we're getting ready to seat our advisory board. So surveys are going out to our community, people with lived experience, people in the scientific field, not unlike a lot of what we did for your guys' Board of Health, actually. So we're trying to be very intentional that we're getting the right people to the table. We're being very intentional about it. And then they will help us lead through the next year of what that work looks like. As of right now, we've got our BFHD core team staff, which is Erin, myself. We've got Jim, Hazel, Sean, Katie, who we've hired through Village Reach, and then Jack as well. Right one. Some of the outcomes that we're really hoping to do is we're going to identify priorities from our community. I think one of my big pet peeves is when we show up and we're like, hey, we're here from the government, we're here to help. And this really gives us an opportunity to ask them, what do they want? What do they want to know about? Is it PFAS? Is it air quality? Smoke and air quality comes up a lot. That became really abundant with Lineage Fire. We learned a lot and our community started to really give us pretty phenomenal feedback. We're going to also identify health indicators out of that as well for people who are using smoke quality again. You know, those people impacted by smoke and air quality, people with asthma, people with COPD, which we know increases medical provider engagements, like medical, when they go to the ER, they go to urgent care. You know, what does that look like for long-term health? What does that impact like long-term overall health outcomes? And then one of the ideal things we'd like to do is then identify mitigation factors, which could be, as we discovered, Lineage, air cleaners, box fans, messaging. That also I would like to then pursue actual funding to help as well, so that we could purchase those things for elderly, our people with children. Making it the full picture circle is really what my hope is right now. And then really at the end of it, my hope is that we're going to sync up with the CHIP so that we won't be running parallel anymore. We'll have integrated that in, and then it also should give us a work plan for environmental health as well. That gives us that roadmap we can start working on and then reassessing every couple of years as well. That was my last one, Laura. Is that it? Any questions, concerns you guys have?
You're zero, right?
Yes.
You are on it.
Oh, I appreciate that. Thank you.
So are there any safety health indicators out there that you think would be appropriate for this community? I'm just thinking kind of outside of the box here, because you know, I just keep reading like every week there's a pedestrian that's killed, you know, by a car, you know, and I don't know if that's usual for this size of a community to have that many deaths related to pedestrian safety. I mean, my goodness, you know, like every week there's somebody that's killed, and I wonder, you know, about the safety of our community. So I don't know what other health indicators, safety.
It's a good opportunity for talk about overlap between living environment, because this is where we've been working really cognizantly between community health and environmental health. Is there
Stand up for us.
sorry, there are components there of overlap, right, with the living environment, the built environment. Carol, you heard that conversation. We're working, the other good partners, critical partners of that conversation are our Council of Government Partners, where we do the safe routes to school and some of those situations where we talk about pedestrian safety, but not just by saying, you pedestrian, you need to be safe, or you driver, you need to be safe, but how do we build the environment so that safety is easier? And I think that's it's a solid collaborative partnership, why we're hoping to get on the same page so that those indicators make more sense to all the players at the same time, versus just kind of my community-based organization, health people, versus our community-based organization, environmental folks. And we want to bring them all to the table so we can say it's about health. Health and all policies moving forward with that work. So this is a great avenue, Carol, to help us, as Sarah talked about aligning with the CHIP. That's our goal.
And I assume you'll be bringing in partners in the community who are in that interfacing and keeping.
Oh, yeah, we've got scientists. One of our big group we're focusing on is city and county planners, because there's an opportunity to have that advanced planning. Pasco's a really phenomenal player of looking ahead of that built environment. We've also got our policy analyst who also is looking at SEEP applications coming through. So when we build a new park, we build a new intersection or school, it's reviewing, this is the project coming in, what are the concerns we have, and built environment is one of the critical ones that we're looking at, because we know we keep compounding and compounding, we need to get ahead of it. So yeah, that's perfect. Thanks for you guys. I really appreciate your time. I appreciate the work you do. Thank you. Take care.
Miss Amanda.
We'll start. Okay, so I've had two major highlights this week. One was my bridal shower, and two was yesterday eating Commissioner Mullen's pizza. The cheesy pizza was good, and it was crispy and crunchy, and it was just right. So thank you.
Rocky.
I had to have it. I know.
What was it at?
He really knocked it out of the park at the fair.
Oh,
yeah.
What about the picture with Donald Trump?
Oh, see, that may get.
Go back to the pizza.
Yeah. Back in the day.
So you have, take it that you have a place there at the fair?
I do.
Okay.
Very smart. There might have been one hair in his food. That's all.
No, it was delicious. So I just had to point that out of, shameless fun. So I have 4 other updates. One is the Lineage update. What we've been trying to do is get a group of our elected officials together to try to really take a look at what we can start doing for the future, especially for unprecedented events that we've seen, like the Lineage Logistics fire. So, of course, Commissioner McKay will be involved. For those not a part of Benton County, but Franklin County, and also non-elected members / our Board of Health elected members are also invited as well. I'm not going to share the exact date publicly. This is a closed meeting. It will be in early October. So far, I have at least a representative, or they themselves will be present. U.S. Senator Pat Murray, Congressman Dan Newhouse, Washington State Governor Jay Inslee's office, the Senior Policy Advisor for General Government. I have Washington State Senator Perry Dozer confirmed, the Department of Health, obviously Department of Ecology, Benton County. So not only Commissioner McKay, but Greg as well over in y'all's office. Sorry, I can't fight you.
No, it's his district.
I know.
He's running for office. I gotta let him have all the-
And also, we have Benton County Fire District 1. We have Benton County Emergency Services, Deanna Davis attending, as well as several members, Janae, Aaron, Sierra, as you just met today, Jim Coleman, and myself. And I believe Dr. Kreger will also be highly involved as well. So as a shout out to him, he has been very wonderful with communications in my realm. So I'm very grateful for him. And he's also
advocating all
highly involved. I know, from pizza to health officers, it's just a thing. So I'm very excited about that. That's been a long time in the works. Again, we're holding it for closed session just because we want to make sure that we take some of the emotion out of it and that we really kind of work on the nitty-gritty report.
I think it's huge. That is a big move for everybody that was affected there. It would have been, yeah. I appreciate you all taking the lead here in the last several months and all you guys do and everything you guys do. That is a big thing to do and maybe be more proactive in the next time. So we're good at it.
Yeah, absolutely. And
I
what's
know that
been
big county emergency services, we're looking at it too. So
yeah, oh, absolutely. Yeah. And it's been exciting too to see that a lot of those who have been invited, like from my understanding, Senator Dozer was out on the property vicinity, obviously McKay. And then we also have Senator Cantwell's office who's been involved, and I know all of you have been really helpful in pushing that forward. And I know Congressman Newhouse also met with some representatives from the local community. So I think it'll be a good mix. It's definitely not something we want to leave our community out of, but in terms of getting their feedback, we do have an exciting update in terms of a survey we sent out to just our local Bentley community who have been affected, i.e. anyone watching. This is the envelope. So we sent this letter out with important information. One, we had a survey. It's and again, I'm not as familiar with Casper, but it is specifically for people very close to Lineage. Our goal is to try to get as much information about how they were affected and really try to get and hone into that true knowledge of how everyone's impacted and how they're feeling. So along with that survey had a special code on it. We also have both in English and Spanish in all of our languages in terms of filling out the survey. So we have a paper copy, we have an online version, and you can also fill it out by calling us on the phone. So we're going to be sending out a media release soon in terms of just making sure that people do not throw this away. Please don't throw this away. I know if any of the media are watching, don't worry, I'll send more information. But along with that comes this piece of paper, both in English and Spanish. It is basically talking about grant and grant money that we have, the Department of Commerce Emergency Response Grant to be specific, and eligible. Those residents are within approximately 0.5 to 1 mile of Lineage Logistics facility in Findlay, and who incurred costs from relocating their family or animals due to health effects from smoking during the Lineage Logistics fire from smoke, excuse me. So that is exciting because we have this money and we want to be able to use it and really give it. And so our way of not just getting responses, but getting the message out there. So on the communication side, we're going to be sharing a lot of that information coming up.
on that survey, does it give like a list of things that are, how does it on the survey, what does it show as far as things that might have they might have been affected by as far as cost. I mean, does it show like homeowners insurance? Because if they've had homeowner insurance claims, whether it could be smoke damage or something with a well or like that, and they claim it on their homeowners insurance has gone up quite a bit already. But once you go ahead and file a claim for homeowners insurance on something specific like that, it is virtually very difficult to get homeowners insurance down the road with another carrier these days. So I think that's going to affect a lot of them that have had homeowners insurance claims. So what I'm saying on the survey, do you have a list of items that they could have been affected by, or is it just general question?
Some of them are general questions. I can get you a copy of that because I can't really recall seeing homeowners insurance on there, but again, I haven't looked at it.
Because that would be one I'd be curious to see how many have actually
Yeah.
put in the claim, and if they do, they will be affected for years to come. I
Yeah.
know that for sure.
Oh, absolutely. And I gotta say that our staff has been really diligent on trying to make it clear and also in the message with the joint elected leaders meeting that we're having in October to really push forward about how we can find ways to track all the environmental health and the risks for all of the residents for long term. Especially because with drinking water, from my very small knowledgeable experience from listening to all of our experts, you know, it does take a 5-year process for any type of the toxins to get into the bottom of the drinking water. But a lot of them are also really shallow as well. So we're seeing a lot of complications that we're trying to get all the data that we can. And so this will be a great chance to see what money's out there. Maybe from, you know, some of my conversations with Congressman Newhouse and his staff, it seems like there might be some opportunities of things that I don't think we even knew out there. So I think that's what we're going to continue to bring forward to you all so that we can keep looking at the future and hopefully never have this happen again. But we're prepared for it in terms of, hey, this was new and we've learned a lot. And so let's keep learning and let's keep diving into how we can do it better.
Absolutely.
It's a hard lesson learned.
Yeah.
Big time.
And there's still, and people out there are still struggling, like you said, for a long time. It's so how can we start still putting some pressure and trying to figure out what's best for public health in general. All right, my last 2 updates. Okay, so branding. We hired Brandcraft, which is a local company. I don't know if you're familiar with them, but I've seen their work. We really enjoyed working with them, but we did put a pause on the new logo because we want to do a survey. But more importantly, I wanted to get your thoughts on changing the name of Benton-Franklin Health District and calling it Benton-Franklin Public Health. What your thoughts were on that? It is a big, heavy lift no matter what we do when it comes to rebranding. There's a business as, I know that we just need at least 2 Board of Health members to be able to give us the go ahead on changing the name. I don't necessarily feel 100% confident yet to say like we are going to do one or the other because I want to hear from the community first. But I was curious to know, as I'm racking my brain, analysis paralysis, you know, what your thoughts are on something like that. And some of the thoughts behind that were trying to move away a little bit from the government perspective and trying to focus on something that not only can be translated very well in Spanish, but it's also a little more inviting. When we went to Risolfo in Spokane, a lot of different health districts have actually started to do business as their county and public health. And it just rolls off a little better. But again, it has to be a gradual process because I know change is not something that can just happen overnight. But while we're looking at rebranding, while we're looking at updating our website in 2025, we want to look ahead over the next couple of years. So I thought I'd ask your thoughts.
I think the public health part it's pretty simple and it's
Yeah.
pretty easy. Benton Public Health is even better. But I know I get rocked. You're probably going on right now. No, but I think, yeah, that sounds good. Pretty basic.
Isn't that expensive to change your brand?
Well, we're already in the process. We already have the funds to change the logo since it is outdated. Our whole goal is innovation and looking at the way that we communicate with our public after COVID a lot differently. And now with our new leader as well, I have to say Janae has brought a lot of innovation into this agency, and we're seeing some really phenomenal empowerment that I haven't seen as much of in the last several years, or at least almost 2.5. But In terms of looking forward, we do have the funds. So yes, we have been covering that.
And you're
That's why
changing,
it's
you're changing the branding anyway.
We're changing the logo anyways.
I mean, the logo, that's what I meant.
Yeah, and since the logo, it came up the conversation of why don't we change the name? So I have for staff that are listening, there is no major decision. I just thought I'd bring it to you as just use you as guinea pigs or just something.
Where does funding come from?
Yeah. It's from a.
Remember I told you I liked your pizza?
She's buttering you up.
We got an administrative grant from the state and to spend on administrative related work. And so this is one of those areas that we deemed we're gonna have to go through rebranding anyway. And so we allocated as part of that money to support the brand.
So instead of Ben, I'm sorry, go ahead.
No, I just like the straightforwardness of it. It tells us what you do. I mean, the health district doesn't tell you really what you do, but public health just says it all.
It's
It's
simple.
Benton-Franklin. It's simple. I like it.
Well, this isn't a new concept. Oh,
Right, fine.
Yeah, this is that Kwani.
Oh.
I'm all for the rebranding the name. The only thing I would suggest, maybe finding a little bit an easier, maybe something that can be like an acronym that's easier to do. Because if you think about it, you know, BFPH, kind of a little bit difficult to say. I don't know if you can think of anything that may be easy as an acronym once you know,
That
use
was
the
my
letters.
first thought too.
Hey, Doc, I tried to go ahead and bid in public health, but those Franklin County Commission ain't gonna buy up on it.
well, and just for some
Like
background.
it could be something like BFF or something like that. I mean, I don't know, just find something.
Actually, that's not a bad idea. Oh no, analysis paralysis on like a whole other agenda. And this isn't a new concept too, you know, the former communications subcommittee, i.e. one of the founders, Carla Prock, you know, has also been looking at this prior to COVID. And COVID kind of put a lot of stop to some of the vision and the ideas, you know, from our former founding communication leaders. So, okay. BFF, we'll look into that.
That's why we're consulting with the experts.
Yes,
though.
Yeah, we have been and you know, my next step's not only with a survey to understand from the community is also to get a better understanding from other LHJs who have done the same and like what the outcome has been, what have been their challenges. Do people even care? Not
Yeah, I'm
really
good
sure.
with it.
So
As an engineer though, I agree with acronyms. I mean, everything we do is an acronym.
I know, it gets crazy, but the public health part.
Yeah.
Yeah, I have a lot more government association with public and actually negative associations with public things than I do with the district. Just because district is geographic, whereas public is like just, I'm sorry, that's the green shed. You know, public restroom just comes so instantly.
Oh, okay.
Sorry.
That's
That's the association I have.
It's okay. Everyone has
Yeah,
unique
we're all
associations.
making bathrooms.
I know.
Yeah.
You know, it's.
Well, and honestly, I have so many conversations with people who know that they, you know, well, I checked with the health district. Well, I think I got my vaccine at the health district. Well, we took the kids to the health district. And so there's,
That's
you know,
another.
there's already a sort of pattern with some people. So that's just where I hear it about it.
More of an established location.
Yeah.
Than an idea.
Okay.
Yes.
I don't know, he started going down the row, so I feel like, you know. You can wait.
Undecided.
Yeah.
I wish Franklin County had enough money to spend on stuff like this. We don't.
I'm gonna send you love to Frank.
But this is all funded through the taxpayer.
Yeah.
Thing, right? Yeah.
The administrative grant from the state, yes.
Which is one of the reasons why we want the community to be able.
So is it, I guess, yes, when you're saying community, is it something you can send a survey out to the community to see what they're saying?
Absolutely.
You can report back to this next meeting saying, hey, we got 90%, yeah, they want to change it to this, or we only got 5%.
We get here.
Yes.
Yeah,
I think that
something
would
a
be
little bit
best.
more, and that was kind of the thing too, but also looking at, you know, how people view it. I mean, I'm a traditionalist, so it's hard for me to even think about changing it. So I think that we just keep exploring and then the right answer will come. Okay, well, I've exhausted that one. And the last one is actually a question for you all, another one, sorry, many questions, but do you all want a communications follow-up in between each board meeting? What, is there something that you feel like you're missing within?
You'd like to see update us, do all those kind of
And I think,
things.
yeah, I think you give us an update, and then if we have questions about something, we could follow,
Okay.
or whatever.
I think it's fine.
Yeah, because I'm thinking if there's like a toxic algae situation or a new study that comes out or something along the lines of, hey, we're doing this community event. Okay, sorry, did you have?
I was just gonna say, I've really appreciated your messages to the board. I feel like it helps connect. I kind of forget about in the interim and, oh yeah, okay, now I remember we're gonna do that. So I just like to receive the messaging. So I'm just a person that I like the communication.
Yep.
Over communication, I think it. Is it something that you want within the emails that Janae sends, or would you prefer a separate communications email? If it gets overwhelming, you can say stop.
We can put anything else.
Yeah.
Because if we want to read them, we can read them. If we don't.
That's true. I'll address it specifically to you.
I know.
And then ask you and quiz you in the next board meeting.
I love reading. It's so much fun.
I remember what it reads, so I like it, but I would say that from meeting all of you and getting to know all of you, if you guys judge that it's something we should know, I think your judgment is to be trusted.
Yes,
Agreed.
agree.
Okay. Any other additional questions? Those are my only updates. Okay, cool. Thank you.
Hello, good. I'm here to officially update you that we have started our negotiations with ProTech. As of July, negotiations began to discuss the terms and conditions of employment of those represented employees within the health district. We are committed to engaging in the process in good faith, and we have an aim of reaching a great agreement with them, and the one that's fair, equitable, something that we can all be proud of. And I know that we are starting this process earlier than we have in the past, and that really makes me excited because I feel like it's gonna develop a great final product. So right now we are just beginning the early stages of it, and I will continue to update you throughout those negotiations and keep you posted about any of the thoughts and ideas that come forward. Any questions? Thank you.
Scarlett. Wait, did I miss you? Oh, I'm
Skip right over.
so sorry. Sorry.
Okay, so I'll make this quick. I want to let you know. So I think most of you are familiar with the Foundational Public Health Services funding that we get. We actually are on a tour from some of the Washington State Legislature that's coming to visit with us and talk to us about how we're spending that money. That meeting is coming up on September 25th at 10 a.m. If there are any of you that are interested in sitting in on that meeting, please let me know. We want to make sure we don't violate any quorums, but we're happy to have you guys sit in and listen as we talk to them. 25th at 9 a.m. And we've got someone from the Senate and Ways and Means, so actually two people, House Appropriations, the OFM analyst, and senior budget analyst. So people there.
Well, I'm open that day. Okay. If you want to sit and invite.
Okay. Other than that, happy.
Everything though, or like?
It's 2 hours. And you're primarily gonna hear what you already hear when we come to talk about foundational public health
I
services.
need to go. Oh, sorry, I got COVID. No,
So 2 hours, and when you're concerned about a quorum, tell me what.
Well, I wanna make sure we don't violate a Franklin
Yeah.
County, Benton County, or a Board of Health quorum.
Yeah.
Okay, so ideally, we try to keep it in that one person from each grouping. But with our Board of Health, it's 8, we can have a couple of non-electeds attend as well.
I don't know my schedule yet.
Okay, you can let me know. You got my contact. Okay.
Yeah. So speaking of legislative visits, which is not quite on the list, I just wanted to let you all know that our Nurse Family Partnership Program is looking forward to hosting a site visit from Senator Matt Benke next week. So he'll be here Tuesday morning to meet with our nurses and other staff at ASCO office to learn about the program and what he can do to help. contributing to some social media throughout the full month. We're participating in the Overdose Awareness Day event, which I have a flyer here for some folks if they're interested. And that is taking place on the August 31st itself. There's a Hands Across the Bridge walk and a lot of local presenters and vendors coming together to have conversations. So Shelley Little is our public health nurse that works in the program, and she's providing some educational presentations on recognizing and responding to overdose, reducing stigma, and the current data trends for our community, which we've shared with you all before. And Shelley's staffing a booth to provide education and naloxone access after that. Our partners at Benton-Franklin Recovery Coalition are hosting a 5K on September 14th. And this organization is an important partner in supporting our bi-countywide effort to open the Columbia Valley Recovery Center at the former KGH Hospital. So make sure you're aware of that event and all the work that they're doing to really help make this a great facility for our community. And then our staff are participated in the planning committee event with state partners. Facing Fentanyl Together, and it's a community resource fair at CBC on September 20th from 1 to 5. And so those are the things that are coming up during Recovery Month. Thank you.
Thank you. All right, move on to executive session.
Yeah.
For 30 seconds.
We'll take whatever time, although I know we gotta get vouchers approved. We can try and do it in 70 minutes.
Yes. 7 minutes.
Yeah, so you know we're running short on time. To include Brandy and Chris Burton's and myself.
All right, we're out of executive session, time for 2:58. Discussion was given, but no decision for May. Last but not least, can I get approval of the vouchers?
Chair McKay, I'll move to the board approves payment voucher numbers 54-2024 through 65-2024 in the amount of $1,331,456.78.
I'll second.
Got a motion and a second, any discussion? Hearing none, all in favor, say aye.
Aye.
Aye. Any opposed? Hearing none, the ayes have it. Our next meeting will be September 18th. This meeting is adjourned.